My name is Frank Malorani. I want to thank this group for having us here. I'm from the Massachusetts College of Pharmacy in Boston. And we have been doing a lot of work over the last 4 years on the opiate healthcare crisis, which, as you know, has impacted every demographic, every community. And so we're here to talk about one specific idea among the many that students and university are working on. So I have two students here with me, Duyan Pham and Vida Rampas, and I want to thank them for taking time to participate here today. So basically, I want to just give you a little bit of a background, and then I'll tell you about the one project that I want to talk to you about. And we can talk about other projects that we're working on as well, but I want to focus on this one particular project. So, like we call what we do the Save One Life campaign, because I think we all know right now that the problem is really overwhelming. CDC says we've lost 399,000 Americans since the turn of the century. So, and in 2017, 130 Americans die every day on average, and that's up from when I started doing this 4 years ago. It was 91. Then it went to 115. Now it's at 130, and so we certainly have not arrested the problem. I know there's a lot of energy, a lot of focus being put on it, but I haven't seen anybody come up with a cure. So a good friend of mine runs a drop-in clinic in Lynn, and I asked her, I said, how do you do this every day? Because I go there and I talk to her, and it's just like this overwhelming amount of people who are struggling. And she said, it's just about one person, one time. If I can save or help one person, then I feel like all of this is worth it. And so I think that's the philosophy that we've tried to take. It's like, if you can help one person, then that has to be enough. Because if you think you're going to solve the problem, then you'll probably get discouraged very easily. But I think everybody can help one person. And that's what I try to tell our students. Everybody can help one person if you want to. So that's really what this is about. It's helping one person. So a couple of background things. And this I found really startling. This was published by the National Institute of Drug Abuse, 2015. Their study said that 91.8 million Americans got a prescription for opiates in 2014, which is about 1 out of every 3 adults. And as I'm sure you know, we are an outlier in the world. We consume 80% of the world's opiates, and nobody else gives opiates out like we do. We give them out for just about anything. And it has gotten a little bit better, but I was talking to somebody the other day, one of my colleagues, and her daughter had her wisdom teeth removed, and she was given a prescription for opiates without any discussion by the dentist. So
Still?
it's like, still, okay?
Just recently?
2 weeks ago.
Wow.
Okay, so the numbers are still staggering. I mean, if you look at the CDC website, we peaked at about 240 million scripts in 2014, down to about 180 million, but it's still an overwhelming number. So far too many people are getting opiates. We give it, before 1995, it was for end of life, cancer, and some debilitating chronic pain, which is how most countries deal with opiates, because they know it's highly addictive, very dangerous drug. Since then, the Pandora's box has been opened. So I know many of you have been given opiates. Your kids have probably been given opiates, and usually without a discussion, which is a whole other issue, because one of the things that only 6 states have is what's called a right to know law. And a right to know law says that if I'm going to give you an opiate prescription, I have to talk to you about the risk of addiction. And talk to you about, if you do become addicted to opiates, there's no cure. It's a lifelong chronic disease that, as you know, changes your life.
Can you tell us what the 5 or 6 prescriptive names are for opiates?
Well, you put me on the spot, so
how would we know if it's an
Right.
opiate? I mean, OxyContin we all know,
Right.
but that's the only one.
Yeah.
That's,
Is Vitican?
Yeah, so
Vicodin.
yeah, so
Percocet. Yep.
yeah, okay, thanks. So OxyContin, Vicodin, Percocet, and I'm sure I just don't know off the top of my head what they all are. But I can certainly send a list.
yeah,
So,
because that would be really important to know, because
Sure.
names jump out at people when you're getting prescribed
Yeah.
antibiotics these days. You go, oh, I'm supposed to be careful with that.
Right.
And if you know the 5 that you should look out for.
Yeah. Absolutely. So we know far too many people are getting opiates. The other thing that we should realize is that it doesn't take long to get addicted. Right? So studies say that for those people who have the addictive gene or whatever it is that causes some people to get addicted, and most people can take an opiate and walk away, but a certain percentage of the population, they can't walk away. And once you become addicted, once you develop opioid use disorder, there is no cure. There's treatment, right? There's buprenorphine, Suboxone, there's methadone, there's naltrexone, all highly effective in helping people get back to a normal life. But getting access to those things is also a big challenge. More difficult to get Suboxone than it is to get opiates. So in Massachusetts, we have 48,000 prescribers of opiates. How many prescribers of Suboxone do you think we have? Just take a guess. 48,000 prescribers of opiates in Massachusetts.
5.
No, it's a little better than that.
10,000.
Okay, so it's about 5%, so about 2,500 prescribers of Suboxone. This is from the DEA. We did a study last summer, which, by the way, is better than the national average, which is about 3%. So even though we have things that can help people with an opioid use disorder, it's very challenging for people who have an opioid use disorder for a number of reasons. And one is the lack of providers. So in any case, what we also know is that it doesn't take long to get addicted. A couple of days, a week. So the CDC reports that 25% of people, 1 out of 4, who are prescribed an opiate for a long term, which they define as 30 days or more, are going to struggle stopping. Okay, not everyone will develop an opioid use disorder, but a fair amount of them will. And when you just do the math, 90 million people getting a prescription, so many are going to be vulnerable, and now we have, the CDC says 3 million people, BU says 10 million people with opioid use disorder, right? Addicted to opiates basically for the rest of their life. And so anyway, so here's one thing that I think you might find interesting. John Hopkins and the Mayo Clinic both did studies in the last 2 years. And what they found is that people who get prescriptions for opiates after surgery usually don't use them, or don't use all of them. Mm-hmm. John Hopkins, 74%, and Mayo was well over 50%. So we know that people who are getting prescriptions for opiates for things other than end of life and cancer treatment often don't use them all. So where do they end up? Right. So oftentimes they end up in people's medicine chests. I think they sit there. Why do they sit there? Well, I might need them later, or just because the inertia of why things sit any place, right? And so the risk of them sitting there is that estimates from other studies say 1 out of 4 teens experiment with drugs, and oftentimes they get them from their parents, their aunts or uncles, their grandparents' medicine chest. So what we are trying to do is intervene from a preventative perspective. And so we got a grant from the National Institute of Drugs about 6 months ago. And we're working with the Central Middlesex police chiefs. So there's 9 communities in Central Middlesex. And they're very excited about working with us on this particular project. And basically, there are ways to dispose of drugs now. Anybody know how to dispose of drugs now?
We have a disposal right here in town, right behind town hall.
Yeah.
There's a locked box you can put them in.
Okay, yeah, so it's very common for towns, particularly, usually they're located in police stations, because there is risk to having them. People might break in, and then there's a cost of disposing of them. So that's a method. It's been highly effective. The other that often happens, and I'm sure Lexington has, is drug take-back days. So a lot of times towns have them once or twice a year. Those are also highly effective. But yet, there's still tons of drugs out there. And the reason being is that if you don't want to go to the police station, don't know about it, don't want to go to drug take-back day, it sits in your medicine chest. So this is an intervention it's an experiment. We don't know what the results are going to be. It hasn't been tried at the community level, as far as we know at this level. So what we're experimenting with is to give you a new method to dispose of your drugs. It's not rocket science. All it is a pouch that will deactivate drugs, and then and it's biodegradable, so you can throw the pouch in the trash. So we're giving the pouches out. We got a grant to dispense the pouches, so there's no charge to communities that participate. And so that's our basic mission, is to try to add another layer of removing drugs from households, where we know there's high risk for people who weren't intended to use them, the diversion going on. So we have these, we've come up with these brochures, which we call the Safe Drug Disposal Saves Lives. So I didn't develop this brochure. This was done by a group in Florida, and it's intended to really get people's attention. Right? So it says, she gets her hair from her mom, she gets her eyes from her dad, and she gets her drugs from her grandmother's medicine chest. So, and so we know what happens, right? And so what this campaign's about is that we have 2 different forms of drug disposal kits. And by the way, there's 8 companies that do this. I could care less which ones you use. We have a grant that gives us access to 2 of the 8. One is called Deterra, and the other one's called Dispose Rx. The Deterra form is a pouch that you open up. You pour your unused prescription medications in. Add water, shake it up, and throw it in the trash. And and the bag is biodegradable, as is the contents. So it should be environmentally friendly. So that's one device. The other is a little bit different, but it basically works the same way. So the content in these attach to the drug and deactivates it. And so this is called Dispose Rx. Walmart was giving these out, by the way, with opiate prescriptions.
I heard that, yeah.
Yep. And so basically, the way this works is you open up your pill jar, you put water in warm water, warm tap water, and then you add this in, mix it up, and then you can scrape the contents out into the trash barrel. I mean, you can throw the pill bottle in there too, but as you know, that's not biodegradable. So if biodegradable is a big issue, then you just scrape it out and put it in the trash. So they both work, and what we're asking is that we're happy to give them out. I have about 75 different pouches here today. If you want to take one and use them, or give them to somebody else who might need them, or go to a friend's house or a relative's house and use them, we do ask that you complete a survey. It's anonymous, and the reason that we're completing a survey is this is an experiment. This is a trial to see is this really gonna work, and what are we getting back? Right? Are we getting back opiates? We're getting back other drugs. And so originally we thought we would only do opiates, but then we said no, we'll expand it to any drug that people want to put in here. And so that's basically the approach that we're taking. So this is, again, the Save One Life campaign. It's one intervention, and I'm enthusiastic about it because I know it's going to help at least one person, right? And so hopefully it'll help many people avoid their son, their daughter, their aunt, their friends get on that road. Would after 4 or 5 days they can't get off of it even when they want to. So, yeah.
And your mission is also twofold, because our waterways are very contaminated with pharmaceutical drugs.
Correct.
So I don't know if that is part of the marketing, but it definitely could be.
Yeah, could be.
Yeah, I had a friend who was, she was prescribed Oxy for something.
Yeah.
I think she had some surgery, and she posted on Instagram flushing it down the toilet.
Right.
Yeah.
And she was proud of herself. You know,
Right.
it was,
Right.
I'm not taking this. And a couple of people went,
Right.
And then she posted again, oops, but I think that's what a lot of people do. I know myself, when my husband had surgery, we had Vicodin sitting up in the cabinet for
Right.
years. I mean,
Yeah.
it just sat there. And finally I went through and threw it out, but I didn't know where to go.
Right. I didn't know we had something behind the library. Like, these are the things that we need to include.
Exactly.
in our-
I mean, a lot of people do know about the disposal boxes, but do you foresee this being distributed at places like a CVS? Are you trying to partner with them?
So, my goal is to see if this actually works. So our study is about, we're gonna work with probably about 12 communities, and we're gonna try to get these distributed in a statistically significant way.
In the
And see what-
mailbox, one in every mailbox.
We don't have the money to do that, so I think the
Yeah,
grant we have
you
is.
can't just drop them in the mailbox.
Yeah,
You have
they-
to mail them.
These cost about $3.50 each wholesale, and these are less expensive, about $1 each, so they're not free. I'm hoping, so what we're hoping to do is build a case that this is really an effective means. And then from there, then maybe we get a CVS or an insurance company interested in it, but that's 2 steps down the road.
Right.
First, we have to get some data that says this actually is effective.
Or-
I have plenty for anybody who wants
Okay.
one.
Or partner with, the water safety.
Yeah.
I mean, they must be
thank
getting grants. I mean, they could maybe contribute. If you market it in terms of water safety as well, I don't know why they wouldn't
Yeah.
pitch
I
in.
mean, I'm thinking of my mother who passed away at age 92 and who was on myriad opioids.
Right,
If she'd be able to figure this out, or my
Yeah.
brother who was, dispensing them, it's pretty easy, right?
yeah. So one thing we would like is that if you know a doctor or you know a pharmacist, ideally, we'd like to have these dispensed with every opiate prescription given by a dentist, a doctor, or a pharmacist. So, so that's really, when I'm working with the police chiefs in the other communities, that's who we're gonna try to get in contact with, yes.
So I have 2 questions.
Yeah.
One, to understand the process. So right now, one, if you got a pill box from CVS, you take the plastic box, you can just throw the tablets into your trash and recycle the plastic box. How is that different from this? And the second question that I have is that if you have 48,000 subscribers of opioids, there must be some place where the actual sort of names and addresses of those doctors is available, and why don't we reach out to them directly with this?
Yeah, that's a good question. So, I don't, I know the Department of Public Health and DEA have their names and addresses. I don't know that it's public information. The SAMHSA does publish doctors who prescribe buprenorphine. And so their information is actually public if they're willing to make it public. I don't know about the opiate doctors, but absolutely, it's all a question of cost, and marketing resources. So, and so we're kind of taking this kind of a pilot where we're working with 9 communities. We're going to see what the results are. If the results are overwhelming, then I think it'll be easy to make a case and do some of the things that you're all suggesting, which make perfect sense. But we're in step 1 right now, which is let's demonstrate that this actually will actually work. Because I've worked in technology most of my life. I've seen lots of ideas which I love, just don't work because people don't use them. I've worked with a student who had a great idea about an app for notifying people about naloxone, and actually the FDA funded this separate group, and these 2 people in Virginia have created the app, and there's absolutely no traction. There's no interest. So I'm hopeful.
And Virginia is an extremely hard hit by the opioid epidemic. I'm reading
Everybody is, yeah.
Dope Sick right now.
Yeah, in West
And
Virginia.
it's even Roanoke. Roanoke
Yeah.
is like number 3 on the list in terms of deaths.
Right.
Yeah.
So I mean, I hope that we get there, but I think we have to prove that this is actually going to be effective.
I really think that like an annual, if there was a marketing campaign of an annual clean out your medicine cabinet,
Yeah.
and these were in your mailbox. Like
Yeah.
we put out food that the mailman collects for the homeless or
Yeah.
for the shelters once a
Yeah.
year or whatever. This is the same sort of thing. Like you got to change your clocks back, you got to change the batteries in your smoke alarms, and you got to empty out your medicine cabinet.
Yeah.
Not just of Vicodin, but also of antibiotics.
Yeah.
Yeah.
Because of, and that's why, you can empty out your container and put it in the trash, and it's going to get ground up in the trash, and nobody's going to get your Vicodin. But it is going into the earth. It's going into the water, and we're all getting all those pharmaceuticals when we are drinking our water.
So tell me, you said you have several communities that
Yeah.
are involved.
Yeah.
What's the process to get involved, and if there was interest in Lexington, who would that have to come through, the selectmen?
So I'm usually working with the police chief and the, and public health, or some combination thereof, so. But, I mean, we're open to work with anyone, if there's interest in working, as long as we have enough resources to go around. I mean, we don't have unlimited resources, we've got a relatively small grant.
When you say police chief, elaborate on that a little bit, please. Do you go in and,
So I've met with they have meetings, the Central Middlesex police chiefs have meetings, I've met with them, and now I'm working through the police chief in Bedford who actually heads up, so we're working together, and we'll,
has
we'll give them-
Lexington been involved in that at all?
They're not part of the Central Middlesex.
Okay.
But, I mean, by all means, I mean, actually Arlington's involved, but they're involved because the person who heads up public health is the wife of the police chief in Bedford, so she knew about it. So if people in Lexington are interested,
Well,
certainly would-
it's interesting because there might not be a lot of initial interest because people don't think about it or don't think there's a need, but if you put something in front of them
Yeah.
and they're like, oh, I could have used this when,
Well, this is
I
why
had this
I
bottle of
like this,
Vicodin in
because
my-
I think this will get people's attention, like, oh,
Yeah.
maybe I should think about
I
it.
know
so.
several kids who got addicted that way.
Well,
Of
the
course.
other approach is, I mean, I know the pharmaceutical companies, people are coming down hard on them to prescribe less. Like, you
Yeah.
don't need 30 Vicodin to get over
Right.
your wisdom teeth being removed. So the doctors need to be prescribing less, but also, as a patient, say, how about just 5? Like I only need a little for pain. I don't
Right.
need gobs of, marketing that, educating on, tell your doctor you need less. You need
Absolutely. I mean, we're working on a bunch of things, so I just came here to talk about one.
Yeah.
I mean, I'll tell you some of the other things that we're working on. We do, I heard you talking about Narcan training, so we have a group of students in Boston and Worcester that we've trained over 5,000 people on how to recognize and respond to an opioid overdose. I've personally been lobbying for 2 main laws to be passed in Massachusetts. One, the Middlesex County DA, Marion Ryan, has actually filed a bill, which is, New York is the only state in the country that actually has an ability for people's co-pays for Narcan to be waived. So the thing about Narcan is that deaths have leveled off in Massachusetts, so they kind of peaked around 2,000. Last 2 or 3 years, they've been around 2,000. I ask people, emergency room physicians and others, why do you think it's leveled off? Most people think that it's the increased availability of Narcan. So one way to increase the availability of Narcan is to do what New York did, which is basically, if I go in and I get Narcan today, naloxone today in a pharmacy, my insurance will cover it except for the copay. We did a pilot last year with 75 of our students. A third of them had copays of $50, which for people in the room, $50. But for a student, they walk away because they can't afford it. And so what New York does is that if I go in and there's a copay and they limit it at $40, the pharmacy bills the state. So I walk out. If my copay is $25, I walk out. I don't have to pay anything. So I'm hoping we can do the same thing in Massachusetts. And the other thing that to me is a no-brainer is that this right to know law. I mean, we doctors, dentists, and others. If I'm going to give you an opiate prescription, I should have a conversation with you about this is highly addictive, and if you get addicted, we can't cure you. And and then I think the rest is obvious, because when you look at what happens to people with opioid use disorder, their lives change in such an adverse way, and for many of them, they don't have a quality of life that people end up in if they're lucky, they end up in rehabilitation facilities, but oftentimes they end up stealing and on the street, and this is a disease that unlike diabetes or hypertension, where we have sympathy, unfortunately people view it as what'd you take drugs for? You
So
know?
there is no side effect label, I mean, there is on a package of cigarettes that it will give you cancer, and there
Right.
is on
Right,
all these things are advertising on television that there's
Right.
the side effects, but there's no label that this is an addictive, I don't know, I haven't studied a bottle.
yeah, I mean, not that I'm aware of, so, but I also know that there's only 6 states have a law that says if I'm gonna prescribe an opiate to you, I have to discuss with you alternatives, so.
Is Massachusetts, you said, working on that? Is that
Not
what-
to
is
my
Baker
knowledge,
doing that?
I've been trying to push it, but, at this point, you know, I think that's something that,
How does Mary and Ryan feel about the right to know law?
I'm not sure, she was very enthusiastic about the other one, so.
Okay.
Yeah,
I mean, because Massachusetts has been on the forefront with a lot of things.
yeah, I
so-
think Massachusetts has done a lot of good things, you know, but,
Yeah,
you know, as I said at the outset, there is no cure, and so I think everyone in the room, if you wanna help somebody, you can, and the more of us who jump in and say, I'll do what I can, don't, you know, then hopefully at some point the curve gets bent and, you know, stopping the prescriptions for things, routine things I think is, you know, we're not there, but
what other towns, you said a couple of towns, I'm curious what other towns are on board?
Bill Ricker, Arlington, and then there's the 9 communities in the Middlesex, central Middlesex, which,
Like Worcester? No, Middlesex County.
yeah, so it's Bedford, Maynard, Concord.
Really?
Lexington is in it, that's what
He said
police,
they
both the
weren't.
police officers told me he's on it.
Is it? Oh, maybe Lexington is part of it. I don't know the top, all of them off the top of my head, but,
Okay,
Yeah, he's part of it.
okay.
Yeah. okay. Okay, so I guess Lexington is part of it. Okay, I didn't have them in the back of my mind, so.
But what does that mean? I still am not, clear, so
Right.
they're part of what?
So they're interested in working with us to roll out this experiment,
Okay,
basically is what that means.
would that mean delivering packets to every household?
No,
Okay.
we don't have the money to deliver
No
packets
delivery,
every house.
okay.
I mean, we probably will get a total of about 10,000 packets.
Okay.
So,
Could you hand out packets at events?
we could, but I'd like to have it a little more targeted than that.
Such as?
So you're looking for volunteers to go door to door.
No, right, we just don't have we don't have enough packets for that. So my ideal target,
Mm-hmm.
so this is where I work with the public health and police chief. The ideal target is prescribers of opiates, hand them out with prescriptions.
Okay,
Or local pharmacies hand them out when opiate prescriptions are being handed out. That's my ideal target. My next level of target is the organizations like this who have an interest in opiates, and obviously I know some of you have seen it firsthand, and if not firsthand, you know that, and so you kind of get it in the hands of people that might be helpful. There's lots of organizations like if you all know about Learn to Cope, so
Sure.
hoping we can work through Learn to Cope. So that's my next kind of target area. And then I'm hoping to get into a few emergency rooms. So Newton Wellesley Hospital, their lead pharmacist is interested in doing this with us, but they're still trying to get approval to do it. So I'm trying to do it more targeted. So I could give them to senior centers. I know seniors have lots of pills. Unfortunately, we did the senior center in Winchester.
mm.
We got lots of
In
pills.
Jenks?
Yep.
Yep,
And but they just wasn't what we were looking for. Well, I mean, we're hopefully getting opiates back. That's our primary interest. But we got a lot of non-prescription stuff and even prescription stuff that I mean, it's great to get rid of it, but I'm trying to be a little more targeted. So that's my concern about, because we have limited resources, just handing them out, because
Pharmacies sound like the easiest approach, if you just gave boxes of them to pharmacies.
so that's why I ask if you know a local pharmacist, and I don't mean a pharmacist who works for a chain, because they're gonna have to go
Yeah.
separate.
Theater pharmacy, I know.
theater pharmacy
Theater
is the
pharmacy's
one.
great.
Yeah,
So that's, so
Would he
maybe
do it, you
you
think?
could ask,
I don't know.
I think so.
we
Yeah,
would
he
give him the stuff,
Yeah,
And so
Yeah.
that's.
Do you know him?
Yeah.
Would you
And I
be
know a
interested
pharmacist
in
on Nantucket Island where
getting
them
there's
connected?
opioid addiction big
Why
time.
not, right?
Of course,
I
yeah.
mean, it's a private pharmacy.
Yeah.
I'll connect you with him.
So if you
Who's that, Liza?
That's my sister.
Oh, okay.
I don't have a
I
good
mean,
memory.
we can, basically, we'll give them this, I'll sit down, we'll
Yeah.
talk to them, and,
What about the hospital pharmacies?
yeah,
You know, like Mass General?
yeah,
Because they're the people handing it out after surgery.
yeah, yeah, so we're just rolling this out now, but absolutely, hospital pharmacies.
Mm.
You know, we've talked to Newton Wellesley, and I'm hoping to get into the VA hospital in Bedford. But
Good luck.
anybody, yeah, I know. Anybody who knows anybody, if you can open a door for us, we'll be happy to talk to them, we'll be
Well,
happy.
if
and
you two
it's-
can connect,
Yeah. We're a Brigham, so I could try.
yeah, she's a Brigham.
Oh, okay.
And
Connect you
also
to the-
knows the theater pharmacy owner.
Yeah,
Yeah.
yeah, that'd be great.
Would Theo's house have a use for this? It's probably not applicable, huh?
Well, I don't know, they've got the Narcan on the walls of the house, I don't.
Yeah. I mean,
I mean,
in
I can
theory,
ask
they're not
them going
supposed to
there
be
tomorrow.
having any
Right.
opioids in the
Yeah.
house anyway. These are people
They're
who
not.
are in rehab.
But I think I think you're barking up another good tree when you're talking about the elderly, because I know we have a
Yeah.
extended family aunt who just passed away, who was on
Yeah.
massive OxyContin for the last 15 years of her life for a painkiller.
Well,
You know, when she goes, the old folks home staff takes it, you know.
Well, in our case, my mother was living independently in an apartment in Brookhaven. And my brother was dispersing the various opioids that she was on. And her level of care was at a certain point with the nursing staff. When she got more ill because of metastasized breast cancer, and we wanted the nursing staff to come in and offer her more support, that immediately meant that they had to get involved in the her use of the opioids, which we didn't have a problem with, she did. But then when she passed away, I mean, there were just bottles and
Right.
bottles sitting
Right.
there.
yeah, my mother was, had cancer at the end of life, and she
Yeah.
was being delivered boxes of fentanyl at the very end, and
She was what?
being boxes of fentanyl.
Delivered.
Yeah, the patches, you know,
Yeah,
so.
patch.
And when she passed away, there were boxes there, and I said to and I didn't know much about it at this point, this is 7-8 years ago. I said to my sister, just get rid of those. And she probably threw them in the trash, you
Yeah.
know, so.
Well, the irony of the whole thing in my mother's case, and I went on a little rant about this a year ago, before she passed away, was that when she was living independently in her apartment in Brookhaven, she was taking medical marijuana, which was great. It
Yeah.
really helped. She was taking tinctures and some topical oil of some sort. When she moved to the nursing care center, they wouldn't allow it. They said that my brother and I could be arrested and they could lose their license if we attempted to give her the medical marijuana. But yet,
You give her opiates, so.
she was on massive amounts of fentanyl
course.
patches.
That'll
and,
change.
I mean,
That'll
I
change.
just, I couldn't even fight the fight because,
Oh, no.
you know, she only had another month to live. But just so you know, I just Googled the top opioids, and it's Vitakin, given to my daughter for her tonsillectomy or her wisdom teeth, Percocet, Oxy, morphine diluted, hydrocodone, Davostat, Demerol, and of course fentanyl. Those were the top ones when I Googled it.
So I have plenty of these pouches here. If people want to take some, feel free. Would appreciate anyone's help, if you can help me.
Yeah.
Sure. Yeah.
Connect to a pharmacist, to Brigham, that
Did
would
you
be
say the
wonderful.
VA? Did you say the VA?
Yeah, I'd like to, yeah.
Okay, I might be able to hook you up with the guy who runs the VA in Wilmington,
Yeah,
Great.
or I can just
yeah.
run that by him and see
Yeah.
if that'd be something he's interested in.
Cindy has my contact information, so you can
Yeah,
get from her.
I'll send
I live in
you,
the Castle,
email
so-
is the best, right?
It's fine, yeah.
Okay, I'll send you his email, but why don't you guys
Can you
connect
tell
up?
me your name?
Because Jen, I
Okay,
don't
the
think I'm in
Nantucket
touch with you
pharmacist.
over
That's,
email.
Frank?
It's just Facebook,
Yeah.
so,
MEL.
yeah.
ARAGNI.
Okay, great, okay.
Yeah,
From
Cindy has
Cindy.
my
Okay.
email address, yeah.
Yeah.
All right, thank you, appreciate it.
Thank you for all your work. Bye.